causing the lower back injury, right? So do you have any past medical history orthopedically of injuries at all?
I mean, I was a figure skater for years, so I was like, when your feet come out from underneath you land on your back a lot.
Okay.
So that happened a lot.
So you have a lot of foot injuries.
No, just like landing on my back a lot, like falling up in the
Okay,
air.
so you have a lot of history of falling on your back.
Yeah.
Okay. And that's huge because now I'm thinking this is very pathomechanical. Right? What's pathomechanical? Very local. Something happened to that region. Trauma. Okay. But past orthopedic history is also what? Stiffness, right? You get stiffness anywhere else in the mid back, in the hips?
No, very flexible.
Okay, so that's a huge. Remember, stiffness tells you what? Possible drivers. So she doesn't have any of that. So she has history of just trauma falling on the back, right? So essentially, always full onset. All right. So when did this start?
Couple months ago.
Couple of months ago. Okay. And then something happened a couple months ago.
Just not as active because I'm studying a lot.
Oh my God. What a tough professor you have, right? And then, has it getting better or has it getting worse?
It's kind of stayed the same.
Kind of staying the
But I
same?
just don't do as much to aggravate it.
Okay. So that's very telling, right? Because the person is what? Avoiding stuff in life, right? And then, you know, I gave you open history in order, but you don't have to go in order. So I'm gonna go straight to you. So what are you not doing then? Are you,
Leaning back.
no, what are you not doing? You're avoiding what?
Specific
Running?
things. Running for a long period of time aggravates it.
Running, okay. And I'm just gonna type up over here as we're talking. So you don't like what, running?
Yeah.
I'm gonna use a blue font here. Okay, running. I'm gonna use that font. Okay, what else?
Certain moves in ice skating I don't do anymore.
Okay, like what?
It cuts all the way back spin. You're literally just like laying all the way back while standing up.
Okay, so for lay back, like skin?
Spin.
Oh, spin. Okay. All right. Anything else?
I guess spin for a long period of time.
Okay.
Often.
So all you guys should be like, I see a pattern. And what's the pattern here? Extension. Just like extension, right? Okay. So onset we said 2 months ago. 2 months ago. Okay. Staying the same. And then, all right. So remember, what provokes is very similar to this, but what's the difference? This is what? Your disability, right? So this is, cause I know you coach ice skate, right? Do you stop doing that as a result of your pain? Okay. Running, right? Did you stop running?
I just don't run for as long. Like I'll run for 15 minutes instead of 30.
Got it, okay. So, anything else bothers you about here? Just lying down, certain positions. You said standing also bothered you, right? So which of those things really bother you the most? Like, it was really, like, if you could change one thing right now, right? Would you want to be able to stand further, run, go back to the ice skating maneuver?
Probably go back to the ice skating maneuver.
Okay, which makes sense because why? That's her passion. Even though sequentially we need to be able to stand in order to do the ice skating maneuvers, right? But it's very important because then you know what? What is her why? What is her why? What's going to motivate her? So when you do the functional activity, the training stuff, everything has to be related to, we're doing this in order to do this maneuver in the ice skating. Okay, you have to do that. Okay, all right. So we already have this pattern over here. Okay, so similar for provoking over here, and you essentially in your pain with coughing, sneezing, that. Does your back feel weak? You're making noises. Does it crack a lot? It makes a lot of cracking. Okay. Okay, over here. So it cracks. Okay. Sharp pain, dull pain.
When I go all the way back, it's like a short pain.
Okay, sharp with extension. Okay. And does the pain shoot down your legs? Which leg?
My right.
Where does it go? Does your toes to your back of your calf, or your legs?
I would say back of my calf.
Back of calf.
But like when I'm in my ice skates, you really don't feel your feet too much. So it could, but I
Got it. a scale of 0 out of 10. 10 being the worst. 5 out of 6. You see right there, where is that? That's a horrible question, right? Because I need to know how bad is it for long standing? 0 out of 10.
After like a long day
Yeah.
standing,
Mm-hmm.
it's like 8, it's like 4.
So with standing, you said 8. You said
4.
4. Ice skating, how bad is it?
Oh, that gets up there to like 6 or 7.
Okay. And then running?
After like more than 20 minutes, it's 7.
Okay. Okay. Why do we do this? Why do we do this? Okay. Because if you just pick one number, yeah. First of all, insurance company is going to eat you up. There's an insurance company that they have. Okay. So essentially, anything below 4, they think you need physical therapy. Okay. And so if you say you start off at 10, they expect the next progress note should go lower, right? The next progress note should go lower and lower, 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 right? So if you pick one number that represents everything, you're not gonna what? Show real progress. So what I do is I say 4 out of 10 with this, 10 out of 10 with this, 10 out of 10 with this. So then hopefully in the next progress report, this number will go lower. This is gonna be harder, right? That number probably won't be the same. But this might go a little bit lower. The next one, I go lower. Maybe you start chipping away with this one and so forth. So you see, you're showing progress in what? In different categories. So one could stay stagnant, the most hardest thing, the other ones are getting better. Okay? The only tricky thing, by the way, insurance companies, they don't care about sports. They don't care about sports. Okay? And the other reason why we do this, you have to show the patient what? Progress. And some patients, you ask me, hey, how you doing? The same. And what I do is, well, how you doing with this category? How you doing with this? How you doing with this? And they say, you know what? I'm getting better with this. This is not the same. It's not. It makes sense because this is the primary focus for now. Then we'll work on this. You must do that because why? They think they're not getting better, and then they're not getting better. They'll start coming back, or they won't be doing their exercises. Okay. So you have to what? Show them they're making progress. That's why we ask questions in categories. Okay. Make sense? All right. And we already did the U. Okay. So right here is hypothesis time. Okay, so do we think it's any of these? No. Oh, I'm sorry. One thing we didn't do is what? Region of pain, right? Where's your pain? Can you put the one finger? Can you show the whole class? So essentially, are you pointing like above the belt there?
These are high-waisted.
High-waisted, okay. So essentially, she's pointing to the lumbar spine, right? Right? You're not pointing to SI joint or anything like that, okay? Thank you. Okay. So that being said, right? All this doesn't seem like it's a possible scenario, okay? Right? Do we think these guys? No. So okay, we one of these two guys over here, right? Okay. Well, which one are we leaning more towards? Spondy. Why? Yeah, her age. Usually, this is an older person. Okay. And also, spondy affects which segment the most? L5. She points it right to L5. So everything is screaming this. Okay. So I'm gonna put what? A Y over here. A Y over here. Just for fun. I'm gonna put a capital. Yes, right. Just to show. I'm already thinking this is why I think the case. Okay. Then, right, so pathomechanical, I'm not looking at pelvis stuff. Yes?
Does that spondy also do unilateral? Is that spondylolisthesis, because that's bilateral pelvis?
Yeah.
So we're also including a unilateral.
Oh, spondylolisthesis,
right?
yeah.
Okay.
Pelvis? No, I don't think that's pathomechanical. Our pain's not there, nothing suggesting that, right? But then, the lumbar, which of these instabilities do we think it could be? Yeah, extension, right? Because her pains with what? Extension activities, right? Not flexion activities. This is what? Flexion rotation. And this is everything bothers her. So everything is screaming this. And she even said what? When I do this, it clicks. It's like textbook instability. Yeah.
So when someone has a spondylolisthesis,
Yeah.
and they come in like, if it's traumatic, in Zanny's case with the acne, and she's been dealing with it for a while. Did the fracture itself, like, heal, and now she's dealing with the instability, and that's what's, like, keeping them hand in hand with each other, or?
The tough thing is that, is it really a spondy? I'm not sure, right? But the thing is, this means what, right? For translation control, right? You don't always have to have a spondylolisthesis to go forward. You can just shift forward. The bones don't have to break and to go forward, right? So that's why I'm putting, when I say spondylolisthesis, a lot of people use it interchangeably for the anterior slide of the L5. That's why I don't take into account the whole fracturing, healing, and stuff like that. Okay, we'll see more in a second. Okay, driver. Anything in their history suggesting all this stuff? No. No injuries. No pain anywhere else. I'm not suspicious of anything over here. Not yet. We'll do our examination. Okay. Okay. So we're gonna do our examination over here. We're gonna do our standing. Can you stand, please? Okay. I'm gonna check out your back. Do you mind taking your shoes off, please? Okay. And then, keep your face over here, so the whole class can see. Okay. Can you lift up your shirt? Okay. And make sure you always tuck it in, because patients will hold it up and then affect all the motion. Okay. So remember, I'm looking for obvious stuff. I'm looking for a big rotation, a hinge. Your high waist. Okay, that's good. Okay, so I'm looking for a hinge. I don't see anything there. Nothing to write home about. All right, just let me know if it hurts. Okay. And when I'm doing this, I'm looking for tenderness. I'm also, to get better, doing positioning at the same time. Okay. So I'm feeling extension here. I'm feeling extension here. I feel the spinous process is closed. So I feel a lot of this, right? Any tenderness? No. Okay. So she has no tenderness, but I feel a lot of extension. But now when I get to L5, right, I really feel for what? Yeah, the step off, and I feel a step off here. Okay. Right. So I feel a lot of extension. Right. When you feel a lot of extension, what do? I wonder if she's stuck in extension. Can you just forward just a little bit for me? I want to see what happens. And you know what? None of these are opening up. Okay. So it seems like she's actually stuck in extension. So I'm thinking, okay, sound like the ERS here for me. Make sense? Right? You see how the little thing there, you can figure that out? Because she's stuck in extension. When I try to ask her to flex forward, none of these guys are opened up. Okay? So it seems like she's living her life in too much extension. Okay. So then, right, I'm gonna go up L5, right? Tenderness there? No? Tenderness over there?
Yeah.
Okay, tenderness over here? Okay, so left lumbar ligament, not her friend. Right one, no. No pain, right? Okay, and then just real quick, any pain? No? 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 Okay. And then, anything there? No. Left keel is very, very tight, right? Not so bad. And the butt muscles are gripping over here, right? I'm not sure if it plays into everything over here until I do my driver testing. Okay? Right. And then, right, I'm gonna go to sacral base. Do I feel which one's more rotated? I feel like she's right rotated, right? I wonder how the relationship between that and the PSIS over here, okay? And I feel like, oh, that the sacral base is definitely more back than this right PSIS. I wonder what this pelvis is doing, okay? So I'm gonna go find the PSIs, and I feel she's actually rotated. Bend forward for me a little bit. More, and we go forward, the right side goes up higher, come back up, okay? Anti-rotation, sacral base, doing this, okay? Right? And then slide my hand real quick, right? Feel the femoral head. Do I feel one popping out more than the other, right? And feel the right one sticking out a little bit more. So now I have two possible drivers, the right hip and the sacral base, and there are pains over here. Okay? Alright, look at that, her hip clunks, right? So it makes sense, right? So that's definitely a driver, okay? And you see that? I did a bad job of also asking besides stiffness and pain, does anywhere else click? Alright, I want to pick that up. And then just put this down over here real quick. Just feeling for ring stuff over here. Oh yeah, that one right there, that's tender. See, she's wincing over here. Alright, so we have, alright. Okay, I don't want to get elbow in the head, so I'm stopping. But so just on palpation alone, I have possible driver here, possible driver here, possible driver here, pathomechanical, clearly too much extension, right? So I have spondylolisthesis. You see how much you get just from palpation? Yeah? Okay? I'm going to do this again, but I'm going to do it without talking to show you how fast it should be. Okay? Alright, so do me a favor, I'm going to tuck this in over here. Alright, just let me know if you have any pain, okay? And I don't see any hinging or rotation stuff. Okay, any pain? No? Ooh, so extension, can you bend forward for me, please? Or stuck, come back up for me. Any pain here? Yeah, pain there? No, okay. And any pain there? No? Pain, pain, pain. Check out the tightness, check out the tightness, check out the tightness, check out the tightness, tightness, tightness. Positioning I already did. Right rotated. Okay, right rotated. I wonder if she's doing this or she's doing this. PSI says that's more forward over here. Bend forward just a little bit for me, please. Bend, 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 bend. Okay, good. Come back up. Check the hips. Right one there. Okay, feeling tenderness there. I'll do that. Okay. And then okay. See? Hold hands. Now 1 second at a time. We'll be here all day, right? Okay. So now I have a hypothesis. When I do my range of motion, I expect certain things, okay? So take a side step towards me. Keep bending forward and touch your toes for me. Any pain?
No.
Okay. And then, how about we do this? Any pain?
No.
And then I'm looking. Can you face sideways for me, please? No lumbar flexion. That's all hips. That's all hips. Right? You see any curves here? No. Okay. This is not part of the examination over here. So just to verify, I'm going to bend forward here, and I'm going to stop her pelvis, right? You should have 35 degrees of lumbar flexion, right? Ready? Bend forward. Actually, no, she has it, okay? So she is capable of flexing, right? She's just not flexing when she bends forward. She gets it all hip. So that's some type of motor control stuff we got to figure out later, okay? All right, so now, bend backwards for me. Does that hurt? And so he faces backwards. And then I'm looking at the hinge, right? Good hinge right there, right? And it corresponds to L5 and everything like that. Okay? So I'm sorry, I know that hurts right there, right? Okay, come back off. How about we go to the left? Does that hurt?
No.
Okay. And how about we go to the right? Any pain here? No?
No.
How about we do that?
No.
No? And then again to the left one time. Any pain? Is that?
No.
Okay. Alright, I'm gonna have you do this motion again. Bend backwards. Tell me when it hurts. Does it hurt when I do this too? Better, worse? No change? Better? How about this?
That's worse.
Yeah, worse, okay? I know it's gonna be worse. You see how slow I went? I didn't go, let's see this, let's get everything done. I was looking at her face, making sure that I'm getting to the danger zone. And some patients won't tell you until it hurts a lot. I said, okay, I'm there. Okay? So we have a quadrant, okay? So let's do this again one more time, okay? So there it hurts, right? And that hurts, right? Oh, sorry. One more time, okay? How about we do this one, H and I? Long side bending, all right? Look at that. Then bend backwards. Okay? All right? Big difference. That's a huge H and I test. Okay? So everything's screaming stability, right? The clicking, the lumbar ligament is tender, pain of extension, the clicking, H and I test. So my hypothesis of pathomechanical diagnosis of extension stability is quite clear now. Okay? Yeah? Okay? Now, since I'm here, right, yep.
Does she have radiating pain?
Oh yes, right, good question. Any radiating pain?
Stable here?
Yeah, we're doing this test.
Yeah.
Okay. Thank you for pointing that out for me, right? Where was it pain?
It was down my leg.
To the calf?
Mm-hmm.
To the toes?
No.
Okay. So didn't go to the toes, went to the calf. Okay. Now, while we're here, right, can you do me a favor? Can you just lift your leg here and bend backwards like this? Okay? We'll do both legs, okay? So lift up one leg there and bend backwards. Does that hurt?
No.
Not so bad, okay. How about other leg, please? How's it? Okay. So you see, positive stork test, okay? And what's interesting, not the left leg, but the right leg, right? So I'm definitely going to be very careful when I check her prone hip extension. How come she's gonna have enough hip extension range of motion? Is she compensating, right? Remember, we're trying to figure out what, right? If you understand this principle, you're gonna be a great therapist. Wherever you have pain means somewhere else is moving too little, right? You're moving too little here, or you're moving too little the pelvis or hip. Yeah. We already know her SI is possible. Hip, she's enter translated and she's clicking. And also when we do this, it's pretty obvious she doesn't have enough right hip extension. Yep.
The stroke test is labeled positive for the leg that's down, so that means extended.
Yeah. So in this case, it's right way.
In pictures, I've also seen them do it like this. Does it matter? Like she's like this.
No, it doesn't really matter because it shouldn't really bias extension. Okay. And by the way, and it's not a balance test. That's why I was holding on to her. Okay. If you have them do this, right, and you think it's gonna fall, then they're not gonna bend backwards. You might miss that. Okay.
Are you taking them into the quadrants?
No, just straight extension. Okay. You can if you want, but historically, stroke test meant that. Okay. All right. Can you do me a favor? Can you hold my hands here? Lift up your leg up, please.
Which one?
That one. And can you go 25 times for me? Go. 1 and 2 and 3 and 4 and 5. I'm looking for no extension thrust, okay? And she's doing pretty good, okay? And to be honest, in the clinic, I'll just stop right there because I know she can make 25, right? Switch, okay? And then do the same thing. 1 and 2. I really care about the right side more because why? That's the side of the radiating symptoms, right? I need to know is to the point that it's causing myotonal weakness, okay? And how are we doing?
Good.
I lost count, sort of forget.
15.
Ha ha ha.
She's done.
You see that? She's doing the whole thrust there, okay? So she does have a positive test over there. Okay? Yeah. Okay, so let's pause right here. I'll open up the computer over here. You can actually take a seat and face the class. I was trying to do it next over here, right? So you see what was positive here, right? So the left one was positive. Oops. I'm gonna do this. Like I said, the left one was positive. Okay. And then that was alright. The QL was bilaterally positive. Okay. And some buttock tightness, but nothing too crazy. Rotator spine muscle is not too crazy. Interspine space was all closed, right? Closed, right? All this was just closed, right? Sacral base was this was here, yes, okay? And essentially her right was this, yes. Okay. There's a pain with extension, okay? You should mark off how much extension, right? So in her case, her pain kicked in around 50%. Okay.
ASIS. I think both ASIS and PSIS be higher.
Oh, sorry, you're right.
Should be PSIS higher,
Yeah, this
ASIS
should be-
lower.
Yeah, this should be lower. Sorry, good point. Changes by cheats. And then over here, she had pain extension, and this one over here, right?
Does it matter that if my hip is into extension while my back is into extension, that causes even more pain?
Yeah, that definitely I'm being suspicious of the hip drive. And positive HMX, yes. Okay? Everything's screaming what? Instability, extension quadrant, okay? And this was positive for the right. Okay, can you take a seat, okay? Now,
Here.
right on top of there, right? Why am I doing thoracic rotation?
Looking for a driver.
Driver.
We have to look for a driver, okay? So I want to know, is that causing pain there?
No.
Okay? Remember, spondyles hate what? Rotation. So, okay. Anything there?
No.
So, pretty good, okay? Hands behind your neck for me, please. Okay. This key, we feel over here so everybody can see what we're doing. Okay. And flexion. Alright, so flexion, flexion, flexion. I really care about extension, alright? And then relax from there. She extends here well. She extends right there, not bad. So nothing too bad. So, middle, she doesn't extend that much. You see over here? If I put a hand over here, the lower, see that? It moves over my hand. See that? Mid. If I force it, then she moves it. But the top, she moves over. Right, so then something maybe mid-thoracic is not extending. Yeah? So when I do a driver testing, it corresponds to the ring we found. Okay? Can you face the class for me, please? Okay. Put your hand behind your back for me. Can you slouch for me, please? Slouch or slouch. Okay, keep your head up for me. Make your right leg straight. You feeling tightness? Tightness?
Yes.
Okay. Does it get worse when I do this?
Yes.
Okay. Slump test. We expected that, but there are symptoms. S1 myotomes. Okay. Can you relax here for me? Right leg up for me, please. Hold it. 1, 2, 3. Make your leg straight for me. Hold it. 1, 2, 3. Foot towards me. 1, 2, 3. Big toe towards me. Push, 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 push. 1, 1, 1. So something going on the right toe. So that's L5. Alright? Alright. It's okay, I won't judge you. Bring your face. How you doing? Leg up for me. Hold it. 1, 2, 3. Make your leg straight for me. 1, 2, 3. Hold it. 1, 2, 3. Push toe. And that's strong on the other side. So that's definitely positive. Okay? Reflex. Reflex. Okay. Does anybody have the hammer with them? I've got to bring it downstairs. In your car.
That should be better.
Thank you, Adam. You are first place. Okay? Hey guys, when you guys do this here, the biggest mistake people do, keep doing this. Right? It's wide here on purpose for arc. So arc. Let the hammer do the work. See? Psh, that. Okay? So. Good. Good. Okay? S1, I care about that one, right? So put the foot in dorsiflexion and that works. See? See how the foot goes down? See? Yeah? You have to put the foot in dorsiflexion. Why? Because it has to be on stretch. When she's sitting on here, the quad's on stretch. That's why it works. It doesn't work when you're not on stretch, right? You think everybody has positive. Okay. You see it? So that's positive. Okay. Everything's screaming what? S1. S1 myotome, S1 this, right? And then there's stuff over there, slump test. Yeah? Okay. Thank you. We just put good case. All right. Okay. Lie down on your back, please. So, mid-thoracic. And we said L5 on the right is positive. Right. Okay. Alright, I'm not going to do abdominal stuff because everything doesn't seem, it seems very musculoskeletal. Okay? Work my way down. Alright? Next thing I'm going to feel is the ASIs. And then I'm curious to see if transverse abdominus, especially, right? Why? Because instability. I want to know, is this guy doing his job or not? Okay? Keep a string from here to here. Imagine there's a string here. And this guy here, pull those 2 points together for me. And relax. Do it again. And relax. Do it again. Okay? So her left one is actually slower to come on. Right? That's why you do both at the same time. Okay? And but it's a gradual build up, right? It's not a big bulge like I-O. Right, go ahead, do it again. Okay? But the thing is, I'm not sure you noticed, she's doing a lot of butt gripping and stuff like that. Okay? So we need to know if the butt is gripping. So for example, right? Oh, see? I could rotate, right? Can you turn on the stomach now again? Can't rotate anymore. Butt gripper. Right? Okay? Right? And it makes sense. In standing, her muscles were tight. So she's getting her stability, not through the transverse abdominis, but she's using her butt muscles. Okay? So, ready? This leg here. She's doing both sides. Okay, turn on. Yeah, see, she can't. Right there. Like, when she lets go of this, she lets go of this. So she's using this as her go-to stabilizer. This guy's not doing his job. Okay? But I'm also doing the same thing above, right? Wiggle test, okay? Can you fire for me, please? Fire, fire. Can't move at all, alright? So she's using muscles here, here, versus this muscle over here. So everything makes sense. Okay, good. So I'll do some training later. Okay? Yeah? Okay. So then, I'm right here. Remember, it should be a flow. Alright? Even though she didn't point her SI, but she did have a rotated on the right side, really clear the SI joint, okay? Any pain when I do this? Okay? No. Remember, positive is pain in the back, not where I'm touching. A lot of people don't like it. Alright, 10 seconds is fine. And then I'm going to switch. Any pain here? Like that? Okay? Good, right? And then, look, might as well complete the SI series, right? Any pain when I do that? No? Okay? Alright, now, since I'm here, check out hip flexion range of motion. And there's so much stuff going on here, right? When I do this, her whole pelvis is moving. She only has about 90 degrees, okay? Which corresponds to hip hooking or standing up stuff, blah, 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 right? Okay? Then, ER, fine. IR, you're on there. You see how pelvis goes up? Feel the dance there? So she has lack of internal rotation there. So we need to figure out why later, okay? I'm grabbing this leg already, just checking out my knee flexion, just checking this out, right? Making the leg straight over here. That's fine over here. Do you feel anything over here? What happens when I do that? Squeezes it. Okay, lift your head up, please. Makes it worse? No? Okay. Remember, this is different from Dura, right? Because the Dura, the slump test, that's a whole body flexion. This is more of a gliding. That's why it's not positive over here. Okay. And then, can I take this off? Okay. So, I'm going to touch your sensation, okay? And you close your eyes, okay? Alright. Does that feel the same?
Yes.
Does that feel the same?
Yes.
Does that feel the same? Okay. Does that feel the same? Right. Okay. So it's equal. Okay. So it didn't seem like the S1 nerve for dermatome got affected. Myotome it did radiating pain. Okay. And then just real quick, do the same thing other side here. Going on here, but should be higher. ER, look at that. So the ER, that pelvis just dropped like crazy. So I don't know why she's gonna have enough ER over there. Flexion okay, dorsal flexion okay, quick flip bonus. Do a crossover sign, make sure, and I don't think it's hurting this by this point. Tightness there. Gets worse when I do this. Lift your head up, please. What happens there? Nope. One change. Okay. Lie on your side, knees face in. L5 test, hold up please, hold it. 1, 2, 3. Top of bottom leg, same thing, go up, hold it. 1, 1, 1. I think 1, 2, 3. She got it there. Alright. In the hip?
Yeah.
Oh, I did not hear, sorry, I was focusing on everybody. And I already did this already. I could have done that right there. Okay, can you face the class now? Now this one I'm curious about, L5, right? Hold it here. Good. That's pretty good, right? Lift your leg up, please. Hold it. You know that, okay? So you see that's interesting. Her toe extension was weak. That's L5. Her hip abduction was also L5. Wasn't bad. So that toe extension, that's not a nerve thing. That's something funky. I'm not sure what's going on with the toe. Alright? But I don't care about that. So it was really S1 now versus L5.
That's kind of what I was getting at, because isn't that also L5 through S1? Like those two, so could S1 just be, you would think it would be weaker though, if
Yeah.
it's a true L5.
Yes.
I'm just working on it.
Yeah. Remember, if there's true myotome, be weakness in everything L5 controls. So toe extension was weak, but this wasn't weak. I was actually shocked because usually people are weak on this one. But everything's screaming S1, S1 reflex, and S1 myotome. Yep. Yeah, so the thing is, remember, you're looking for compensations, right? Anything past 45 degrees, they're using the TFL, right? If they're doing the whole classic lean back over here, they do People won't do this and go up. They'll move the pelvis back like this, right? And you, oh, they're doing a good job. Nope, that's TFL. But TFL is also innervated by the same level. So I'm like, for my tone purposes, I don't care. But for muscle training purposes, why is glute medius weak?
You counter that by maybe having a little anterior?
No, you just either tell them stop, right? If they can't do it, okay. Remember, this is my tone. I know you guys can see too. You guys learn. Oh, that's happening. You stabilize. You can doing this. Those are breakouts, right? I don't care about all that stuff right now. I care about the main guys for a functional task. Okay, lie on your stomach, please. Okay. Any pain when I do this? No. Nope. 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 Yeah. Okay. All right. Right hip extension. That's what I'm curious about, right? From standing, and then. Oh, let me do all the work, okay? You see right there? Look at that. That's all she has. If I go further, you see what she's doing? She's rotating, she's doing everything. So she definitely has lack of hip extension. You see that difference there? Please don't do this in the clinic. That's lumbar spine, rotation. This is all she has in extension, okay? Can you head this way, please? Yeah, head that way. I can show the class the other hip extension. And then, see that? That's hip extension, right? You see that, right? Nothing moving here. Yep.
The lumbar PA testing, what are you looking for?
Okay, you're just looking for aggravation of symptoms. Yeah, we'll keep it simple with that. Yes. Okay?
Stiffness, no?
Huh?
Stiffness, I thought.
And what? Yeah, for stiffness, aggravating symptoms, right? Yep.
If the PA, the pressure was positive, she had symptoms of that, wouldn't that like rule in your spondy hypothesis more?
Yes. Yeah. Okay, last thing about multiple testing. I'm really curious about that, right? Because if the transverse abdominus is weak, I wonder if the multifidus is weak too. Okay? So I'm gonna go on the left side first, right? And lift up your leg over here, please, and down. And do it again, please. Okay? Not bad. Do it again. So if this fires, good. Okay? Sometimes harder to do this and the hamstrings, but then not my focus on here. Do it again. So she does hamstrings. So between here and here, this one goes first, then this one. Between this one, this one goes first. So therefore, 1, 2, 3. See how I did that? All right. Okay. Now I care about the right side, because that's what all our symptoms are, right? So ready? Lift up your leg for me. Left leg up. And come on down. And then, can you do it again? Okay. And then do that again. Relax. Do that again. And I'm sure you're noticing, right? Remember, each level has a multifidus. I'm checking each one out. Go up, please. That's fine. Remember, right off the spine process, right? Up, please. That's fine. Up, please. Oh, not fine. And check it to L5, S1. Not firing at all. Okay? You can make the mistake just only doing these. Yeah, everything's fine. So this one here does definitely. Okay? And then do it again. And glute max not firing at all. Okay? So the multifidus is weak, right? Okay. You can sit on up, please. Okay. Yeah, you can take a seat. Thank you. For your help. Now we're going to analyze the results, okay? So in supine testing, we noticed what? Was